First of all, I want to start by saying that even though health disparities, health inequalities, and health inequities sound like similar terms, they have different implications. As mentioned by Howell et al. 2022, health disparities are basically what we call gaps in the healthcare access for different subpopulations based on their race, their ethnicity, their sexual preferences, their social economical status, their languages, and even if they have disabilities or not. If these gaps become large enough, they become what we call health inequalities. So health inequalities are the uneven distribution of the health resources that can lead to heightened burdens of diseases, injuries, or even death in a subpopulation. If this persists over time, it becomes what we call a health inequity or a moral injustice, which is the decrease in the life expectancy of these populations based on the vulnerabilities that they are facing and the decreased access to the health care services. Why is this important for a healthcare administrator? This is important because it allows a healthcare administrator to identify the needs of the community that surrounds the facility and to be able to plan strategically and analyze what the population needs and how to prioritize and what measures to take in order to meet those needs. We can mention disability as one of the major barriers that the United States population is facing currently, considering that up to 21 million adults aged 18 to 64 years in the United States is facing a disability, and only 44% of these patients have reported to visit at least once in the past year a medical office. Additional to this, Johansen and Byers in 2025 reported that up to 80% of people with disabilities have reported to have at least one underlying chronic medical condition. A healthcare administrator can address this barrier by thoughtful delegation and by exercising oversight. One delegation strategy that they can use is the creation of transportation units that can assist people with disabilities and enhance their access to healthcare, closing that gap. Other thing that they can do is start hiring personnel that is more skilled when treating people with disabilities, especially for the laboratory and for the staff that is going to be his first contact. Which also brings to the other one is to request and to maintain resources in the areas that people with disabilities are going to use, such as the examination rooms or the areas where they are going to be provided a service and make it more accessible. Additional oversight measures that we can take is to continuously monitor the strategies that we are going to implement and to enforce the procedures or the policies that follow the CLAS guidelines as well, to enhance the cultural competency among our staff and foster empathy, foster tolerance, foster respect, which will help us with the communication aspects and the collaboration aspects that will maintain the iron triangle in healthcare as well. This also boosts the performance of the team, the performance of the institution in itself, reduces cost, and also delivers high quality care that is focused on the patient, and it's meeting the needs of the population as well.